Imagine being told you're safe twice. Surgery's done, chemo's done, blood test says you're clear. And then 1 year later, the cancer comes back. What went wrong? We see this all the time. We've been doing this for 2.5 decades. I'm Dr. Dino Prato, and for these 2 decades, we've helped patients who have been at the top cancer hospitals, done integrative care, move from guesswork to true precision oncology. And today I want to share a story. It's told simply at an eye level about why small blood tests and standard playbooks feel reassuring and yet still miss the deeper picture, and how a full precision method can change the path forward. So Emma's first battle. She was 44 when she found out she had 2 small lumps in her left breast. She was scared, but ready to fight, and she had a plan. The standard of care plan was imaging, biopsy, and then a full mastectomy because of the location of the tumors, even though they were only 2 lumps. After surgery, she did a full dose of chemotherapy following the NCCN guidelines. That's the National Comprehensive Cancer Network guidelines, the same one-size-fits-all playbook that everybody uses across the country at all the top hospitals. Emma wanted every tool. So between treatments, she went to a well-meaning integrative doctor who offered her a blood test called a Sinatra DX. Well, the clinic even called it a genetic test for cancer. It looked as a simple signal across small genes and about a couple dozen genes in the RNA sector, and they gave her a single score and it read low concern. That felt good. Surgery was done, chemo was done, green lights, everything's looking good here. Emma rang the bell, family cried, everyone exhaled. For months, life looked normal. Again, school drop-offs, weekend hikes, coffee with her sister. Emma tried to forget the hospital spell. But at month 12, a strange ache showed up on the other breast, and a mammogram looked fine. The blood test hadn't warned her. "You're probably okay," she heard. "Let's watch and wait." Emma wasn't okay. The ache grew, anxiety, worry. She came to see us. And before she came to see us, her doctor told her that they wanted to do surgery on the other breast because they had found a lump that was visible after they ran further imaging. So why is she still scared? You see, we sat with Emma and we drew the full picture. The Sinatra DX, some small genetic test, and there's a lot of these out there. It smells like smoke, a quick signal to the blood from a small panel of genes trying to help flag the risk, but it doesn't tell you what you need to know. It doesn't give you all the detailed information, which comes from comprehensive precision planning, complete ecosystems, which are missing today in oncology. So which DNA mutations were driving her cancer, and what were the off-label integrative and immune system therapies she needed? She didn't know. She was doing one-size-fits-all. What were the right RNA pathways, which were the genes that were driving her cancer? She didn't know what was really causing her cancer, driving it, so it returned. Where was the cancer's immune system? Around the tumor. Not just a signal, but the true spatial biology of seeing where that immune system was positioned around the tumor. And how could we have enacted that immune system to help her fight and win the long-term battle with cancer? She didn't know. So she got a smoke map, one of these tests. Exactly, this is what happens. To build a true plan, you need full, deep mapping. And that's where Meta-Onco comes in, the system we built in precision oncology, which is next level and parallel really to nothing else because we built it with deep planning. So in this case, we told Emma, let's get some testing done and get out of this guesswork. We ran all the tests. We looked at all the mutations. We saw how the cancer grew. We saw how her immune system was weakened. We saw what brought on her cancer. What were the infections and chemical toxins, all with deep sequencing, thousands of markers, many times more than anything she did before. And then we built the custom treatment plan. We found the set of the right targets, and in our pharmacies, we custom built that. We built them and we showed which genes we needed to affect, and we needed to look at what were the drivers of the cancer. And what we saw was these active resistant pathways, which were actually made worse by the high-dose chemotherapy and the surgery, because we could have treated it significantly different had we had her in early. But now we had these blocks and we had to deal with them. And so we do, like we do every day. So we went in and we froze the other tumor, keeping it totally intact, killing it, freezing it, cryoablating it. Then we rebuilt her immune system and targeted her chemotherapy to microdose, gave her phytotherapeutic agents that were specific for her, and we made that area of her tumor that was cold hot. We got her T cells involved, and we broke that stromal barrier by going straight to the tumor using interventional radiology oncology. And now we've fixed that door. We got the immune system enacted, and we brought the patient into remission. And we're able to monitor her with advanced circulating tumor cells, methylation scores, vesicle scores that help us to understand why that cancer was there in the first place and keep her in remission. Now that's true precision oncology. That's what every patient deserves. Targets and combinations, not one size fits all. And they need to be carefully designed and selected with doctors that are experts experts in molecular planning, not just integrative care or standard of care oncology, but molecular planning, which has taken me, with every doctor that comes on our team, we have 40 plus doctors today, about a year and 2,000 hours to be minimally proficient in molecular targeting so that you can combine these agents, build the immune system, and our molecular tumor boards meet regularly to discuss this for our patients. So then she had no side effects. She felt great, was able to go hiking, had lots of energy, felt good. Her immune system was intact, and her cancer went into remission and health. And we did that because we also delivered genetically targeted fractionated chemotherapy, which was microdosed, 10% the normal dose of chemo, but with the right targets. When we tested her, we found that most of the drugs she had taken were not the correct ones for her because they weren't typed for her. And then when you do these microdose chemo, you actually help the immune system because you don't wipe the immune system out. You squeeze the information from the tumor so that the immune system, as the tumor is dying, the immune system gathers that information and uses it for the rest of the body. Then we went straight to the tumor using chemo-immunoprecision injection. And this is an interventional radiology oncology approach where we took a catheter the size of the hair and we put it right into the belly of the tumor, killed the blood supply, killed the tumor, came out without all that toxic effect going anywhere else in the body. Because when you do IV chemotherapy, maybe 5 to 4 or 3% make it to the tumor, sometimes even less than that. So where is it going? Harming. We avoided all of that. We got right to where we wanted to go and got the immune system response we wanted. So even some more advanced cases like we see where breast cancer would have been spread to the bone or brain or other cancers, we can enact technologies like advanced autologous adoptive immunotherapy, your own natural killer cells and dendritic cells to fight that cancer. Emma didn't need that because we actually were able to get to it soon enough. We were able to adapt care and help her. And then the imaging and the symptoms cleared and she went into remission and she's holding remission. This story I'm sharing with you, it feels like it's something unique or special. It happens once in a while. This is the bell ringing ceremonies we have on our clinic floor every week with all different cancer types because of the technology and infrastructure that we've built by the grace of God. And it's here to help. It's here to change the game in cancer. It's here to help people heal and get to the next level. So when you have these stories, the patient always said, I wish I would have heard about you sooner. I didn't even know this existed. I didn't even know that I was in the wrong direction. I didn't even know that I got the wrong care because I didn't know that Envita existed or the work that we do with our technology. And so I just want to encourage you, don't be afraid, get the right testing, get the right mapping, get the right care. It makes all the difference in the world. I hope this story shared with you what is commonly seen by our doctors every day at the clinic with literally thousands of patients that come to us and how we can change that to make a difference for people. I'm Dr. Dino Prato. Thank you for joining me, and may the Lord bless you on your journey to healing.